Our mission is really just to make life with diabetes easier. We want to make an impact for people with diabetes from all over the world.
Welcome to Startup Health TV, where we celebrate the entrepreneurs and the innovators who are transforming health. I'm Logan Plaster. We're here at the American Diabetes Association annual meeting, and my guest right now is Greta Ehlers from Diabetes Center Berne, DCB. Great to see you, Greta.
Great to meet you. Great to see you. Thanks for having me.
Yeah, we have had multiple companies in the T1D moonshot who have come through DCB. I've heard amazing things, but now that you're here, I can get more details. Tell me about the program itself and what your role is there.
Absolutely. So we're a non-profit organization, and our mission is really just to make life with diabetes easier. Sounds very simple, but it's really just that. We want to make an impact for people with diabetes from all over the world. And we do that in different ways, but one of the ways is our DCB Open Innovation Challenge, which is probably how all the startups kind of, came in through there.
Sure.
It's a global competition. We run it every year for the fourth time now in 2024. And it's basically a big award globally where startups from all over the world can apply.
Okay. What gets you the most excited about, let's say, the last couple of cohorts or classes of folks who have applied? What kind of technology are you seeing that is just getting your attention?
I think obviously the whole topic around artificial intelligence is huge. And I know it's become a bit of a buzzword, but it does make quite a difference. I live with type 1 diabetes myself, and it's really interesting because I get to test these things. So for me, it's really nice to see kind of the startups or people with an idea kind of on their journey to getting it off the ground, and then in the best outcome, obviously, test and use it. And AI does make a difference because not having to calculate your bolus yourself, for example, just saves a lot of time. And I think non-invasive glucose monitoring is also very big at the moment. It's not quite there yet, but I think I'm excited to see where it will lead.
Okay. So the program itself, you have the Innovation Challenge, and then what are the other aspects of the program?
So basically how it works is that it's in an online platform. We have an application period. Startups can apply. They just hand in like a pitch deck or a description of their idea. Then we have an internal evaluation committee, and we cut it down to the top 20. So this year, for example, we had 100 solutions submitted, 100 idea submissions.
Wow.
And it's really impressive.
From all over the world?
From all over the world. I think last year it's always been around 70, which is exciting, right? Because you would think, I think the second year we did it, we were afraid that, we've had, I think, 75 ideas the first year.
We already saw them all.
And it's like, what if we only get 15 submissions?
Yeah.
But actually the fact that we get around 60, 70, 100 now every year, that says quite a lot also about the unmet need.
What are you seeing in terms of the spread, the types of companies? Is that shifting? Is the spread kind of similar year to year? Are we moving more towards AI companies? Obviously that's going to be one of the growth areas, but are we spread across the continuum of care?
Yes, I think we always get a bit more digital solutions just because I think the process is a bit shorter. If you have like a proper medical device, it's harder, it takes longer. Whereas digital solutions, you have some very gifted people and they hack some out and it's online really. So I think a bit more digital, but we get new devices. We get a lot more, what I see this year is more complications related. So eye companies or for diabetic feet, stuff like that also comes in.
And what happens to the companies who win? What's the process, post-competition?
Yeah, let me start the step 4 before the finals because that's really cool. Once we've cut it down to the top 6 solutions, so the finalists, we have a 1-week boot camp in Switzerland. Oh, nice. And we invite all the startups, the 6 finalists, to join us for 5 days in Switzerland, in the mountains.
In Berne?
A bit outside. Last year we had to go up with a little cable car, and proper boot camp spirit.
I love it.
And then we do one-on-one coaching, mentoring, plenary sessions. It's just really nice spirit, having everybody in the room. And then there's a huge live award ceremony where the finalists pitch live on stage. And then we have an external jury kind of selecting the winner. And then they get funding and in-kind support, so it's shifted a bit over the years. But
I'm fascinated by the fact that you do that boot camp in Switzerland. It's not easy to get to necessarily. People coming from all over the world, they have to work to get there. And once they do, they have this very special, highly personal experience. I get the sense from people who I've met who've gone through DCB that that is sort of like a real life-changing moment. They make some real bonds, they build community there, and it's just, I find it interesting in this increasingly virtual world that these sorts of events end up being the linchpin for a lot of people.
I think that's what makes a difference, as you say. It's a lot of it is virtual, just because we're operating globally, and we can't fly everybody in for every step of the journey. But at that point of time, we will, and it makes a huge difference. And for us, it's really nice to see how well the startups get along. Like, we obviously have our experts, we have the DCB team there, but they really also help each other and kind of like, oh, we're working on the FDA approval, and then somebody else has an insight because they've just been through a similar thing a couple of weeks ago or something. It's really nice to see that. Obviously, it's a competition, but they're all kind of fighting for the same course.
Yeah. How is DCB funded?
We're privately funded by Willy Michel, who's he's in Switzerland. He's been Ipsomed before, the former CEO of Ipsomed. And we're not an Ipsomed foundation, but we're privately funded by him.
Nice.
So,
and you're able to fly folks in for that boot camp?
Yes, we do that for the boot camp. We fly them.
Very nice. How'd you get into this work? And you said you have type 1 diabetes.
Yes.
What's been your path towards DCB?
One of my colleagues, who's an innovation manager at DCB, Maren Schintz, she has type 1 diabetes herself. We kind of connected over social media, I think 5-6 years ago. I was working for her startup back then, and she started at DCB, and I think half a year later she was like, we need someone else. I think you would be a great fit. Do you want to move to Switzerland? And I hadn't been to Switzerland before, but I was like, sounds great, let's do it.
Where were you living at the time?
In Sweden. I did my master's there.
Okay, what did you study?
Strategic communication, so a lot of kind of branding, marketing,
very nice,
crisis communication, which
and
hopefully we don't need at the startups.
Yeah, and how have you liked working in a field that you have such a personal connection to?
I think it does make it different because it's so intrinsic somehow, you know? Like, I obviously also get to see what difference it actually makes for the people. It's not abstract in a way, it's very concrete.
I find the type 1 diabetes community so fascinating because it's such an engaged, often, well, I mean, it runs the gamut, but you have folks here who are young, engaged, intent on finding solutions. And yeah, it's like the whole "we're not waiting" moniker, like ready to build something to help me live my life now. And so for you to be there, and like yesterday I heard presentations about new solutions, and the questions were all from people managing their type 1 diabetes today. And so the questions were so pointed and were so relevant. They're like, I'm thinking about how I'm going to go to sleep tonight. And there's just something so potent about having someone like you work there, get these pitches, work with these folks and say, this affects me every day, if not every hour of every day.
We're actually, I think, 4 people in the team. Our CEO has type 1. I think it's quite a big ratio of type 1 diabetics in the DCB team.
Do you have a sense of what you would like to see in the next cohort? So have you ever thought like, oh, I really wish someone would build this type of startup and pitch it to us? Like there's a gap in the market.
I think the biggest gap in that sense is something like a fully closed loop. I always say managing type 1 diabetes just takes a lot of time. I mean, there's these very concrete things like you change your infusion set every 3 days, but I think the amount of times a day you think about it, you know, like, oh, how much does this coffee have, like the amount of carbs? I think the more that gets automated, the easier it is for everyone living with diabetes. So I think there's obviously, it's coming up now also with the help of AI, but I'm excited to closing the loop.
What role do you feel like startups play in that process when you have these big legacy enterprise companies? It feels like there's kind of this divide. You have folks like teams of 1, 2, and 3, pre-seed, pre-revenue companies, and you've got your big players who are also working on the same thing. So where do you see the connection points between those two groups?
I think with these small startups also what we see is that a lot of the founders also live with diabetes themselves, and that's, I think, why their ideas often are so tailored, or they kind of really know this problem needs to be tackled because they live with it. So, and then maybe we need some of the big players to kind of take it to the next level. But I think the innovation coming from these small startups is just insane.
Yeah, it's fresher, it's more immediate. But I guess my question is, how do we, and I'm thinking about this because we have our type 1 diabetes moonshot, which is how we kind of intersected with some of the DCB alumni, and they have great ideas. And then the question is, okay, how do we connect the dots to the Dexcoms of the world, or whoever is actually in market with the devices, and say, we need to get this great app, we need to get this great algorithm into market. I don't know. What kind of work does DCB do to kind of try to connect those dots from startup to industry?
I think our network,
Yeah.
because we do have a very big network also with the industry, and we host these dinners at conferences where we
Okay.
try to bring everyone together, researchers, industry, startups, so that people actually start talking to each other.
Nice.
And then, I know it takes time, but
Yeah. And what is so there's the boot camp, there's the finalist, and then is there sort of like a post, is there like an alumni life cycle?
yeah, I think for us it's really important that the support doesn't end with the end of the challenge. And
Okay.
we're still in touch from finalists from the first year,
Which was when?
2021.
Okay.
It's the third
Okay.
year.
So this is relatively new. I
Yes.
didn't know when it started.
So the DCB was founded in 2017,
Okay.
but then it took some time obviously to set everything up, and then 2021 was when we did the first challenge.
Okay, very nice.
And we're still in touch with them, and obviously all these conferences are always great to see them, and
Yeah.
we always tell our startups, you can always reach out and we can connect you to someone. We do follow-up grants.
Yeah.
And it doesn't end with the challenge. And it's really nice to see also, we're here now, and then we see some people we've been in touch with 3 years ago and see what's happened in the meantime.
Very nice. What are you most excited about for the next 12 months?
I'm really excited for the boot camp, and seeing we have the big pitch day now coming up where we select the finalists for this year's challenge. And
When is that?
I think 25th of July.
Okay, so
that's
it's a summertime thing.
Yes, and it's just so exciting, and then kind of coming together in that boot camp, and it's just such a good kind of spirit there.
Yeah.
And we have a bit of a different setup for our award ceremony in October.
That's awesome.
And it's nice. It's nice to see. I love it. Kind of
Yeah.
having everyone in the room and brainstorming together, kind of developing ideas.
Well, I couldn't be more of a fan of bringing folks together in real life. There's so much that you can do virtually, but the fact that you're doing that boot camp together, the relationships that are forming, the potential collaborations that can come out of that, I think are exponential compared to just an entirely virtual community. Which can be very powerful and very strong, and we've seen it through, collaborative sessions on workshops and things. But bringing people together, like here at the ADA and at the boot camp, is huge. So, Greta, thank you for giving me the rundown about the DCB. I have noticed that the alumni that have come to us through the program have a certain mindset and a certain excitement, and I'm sure that comes from the ethos that you all have set up. So appreciate the work that you're doing.
Thank you.
Wish you the best.
Thanks.
All right. Have a great day.
Thanks.